Hello guys, news update number 43. So the Zika virus, which was in news 4 5 years back, now is again resurfaced because in the state of Kerala, for the very first time, 13 cases have been detected, and more testing is going on. So this is not like widespread. It is in the one of the district, the capital district. Okay, so there this has been reported today. So there are different newspaper articles, national and regional, that Zika virus detected for first time in Kerala. 13 samples from Thiruvananthapuram test positive. Then Zika virus infection confirmed in Kerala. Now staring at a third wave, COVID wave, Kerala now reports 10 cases of Zika virus. So already Kerala, the number of cases were very high compared to all the other states. Kerala's number were not going down. So in between that, now this Zika is also a terrible thing to happen. Okay, and whether such a thing has happened before, if you see in 2016 also, there was an alert that Zika might affect or hit Kerala and Tamil Nadu, but it did not happen that time, and now the first case of Kerala has been detected. So now what has happened is the presence of mosquito-borne Zika virus has been confirmed in Kerala. As many as 12 of the 19 samples sent to the Institute of Virology in Pune from within the Thiruvananthapuram corporation limit have tested positive for Zika. So they have been, this is the institute, you should know, Institute of Virology in Pune. That is where anything which happens, the testing will be done. Okay, even when the Nipah virus was there in Kerala an year back, that time also it was sent to that institute only. Now most of them who are like affected are the staff of a leading private hospital in the capital, and all of them have been discharged. However, the first confirmation of the presence of Zika virus came from the serum sample of a 24-year-old pregnant woman that was sent to a private lab in Coimbatore. She was treated in a private hospital in Parshala outside the corporation limit. The lady had a normal delivery on July 7 and the child is fine. Okay, usually pregnant women, when affected by Zika, the child will have certain deformities, but here the child seems to be fine. Okay. The Zika, it is a non-fatal, but it could be dangerous for pregnant women as they can pass on the virus to their infants during deformities, causing deformities. So we'll see more in the video in the upcoming slides. So she actually was admitted in the hospital on June 28 with fever, headache, red marks on the body. The test conducted at the hospital confirmed that she was positive, following which her samples were sent to NIV Pune. The condition of the woman was satisfactory, though she does not have any travel history outside the state. Her house is on the Tamil Nadu border. A week ago, her mother had shown similar symptoms. That's what the report has come. Now, as I told, Corona already is like almost the third wave. The Delta plus variant is going around here and there. Other countries are already affected. And Kerala also, the number of cases, if you see 15,600 cases per day, it is still going on at that rate. Okay, 5-digit numbers. And total death is also crossed 14,000. The cases have crossed 30 lakh in totality. So it is like not ending. And on top of that, the Zika virus also has come. Now, the health officials said the Zika infection could be easily brought under control by adequate rest. In fact, there is no antiviral treatment or vaccine against the Zika virus at the moment. The best preventive method is to avoid mosquito bites during the day. Okay, if you Google for the medicines and all, certain tablets kind of thing, certain drugs kind of thing, names will come. Okay, but most of them are either under testing or it's not WHO approved. Okay, it's like some people are telling it is approved, some people not approved. But if you know the real fact, it is actually not available. Okay. So again, doctors are telling like it was out of curiosity that this test was done. Okay, because suspected patients were like we tested all these suspected patients for chikungunya and dengue as they showed typical symptoms, but the result were negative. Okay, so but we wanted to make sure that the fever was not the result of any other kind of virus. So they did a test and they found like it is Zika. Okay, because Zika was never there in Kerala, they never bothered or thought like it could be Zika. So simply for exploration they tried it, but it actually showed positive. Now, the health department source said that in most cases, the Zika infection is asymptomatic. Okay, you will not have any symptoms, and those with symptoms usually get ill 3 to 12 days after being bitten by the infected mosquito. Symptoms include mild fever, headache, muscle joint pain, vomiting. Okay, this I'll show you detailed slide is there for symptoms and diagnosis. So, if you see, the illness is characterized by pink eye inflammation, the skin rash with red spots on the face, neck, trunk, and upper arms, which can spread to the palms or soles, and sensitivity to light. Some may also have a lack of appetite, diarrhea, abdominal pain. So it can be like usual fever or like a exaggerated kind of thing. Okay, like people tell this will happen, that will happen, but different things are there. It's not scientifically written down anywhere. Okay, what are the proper symptoms of it? Because every people get it in a different way. Now, this Zika virus infection is caused by this. a virus belonging to the flaviviride family. The virus is primarily transmitted by infected daytime biting female Aedes aegypti and Aedes albopictus mosquito. Okay, so first thing is female mosquito is the one which usually goes and bites the people, and there is this daytime thing and the nighttime thing. Okay, like this is active from the dawn to dusk. But that doesn't mean you are safe by the night mosquitoes also, because that will cause the other things like chikungunya. Okay, so the daytime one is the one which causes Zika, but the other one also causes certain diseases. Now, seen mostly in Mexico, Central and South America, and Caribbean. This was first detected in India in 2017 when 4 people in North India were found infected. This was followed by minor outbreaks in Madhya Pradesh and Rajasthan in 2018. There was also a minor outbreak in Tamil Nadu. Okay, so as I told, in Kerala it is for the first time. And if you see the history, it started in African country, and around 1947. If you see the according to WHO, the Zika virus is a mosquito-borne flavivirus that was first identified in Uganda in 1947 in monkeys. It was later identified in humans in 1952 in Uganda and the Tanzanian, okay, nation Tanzania. Now, outbreaks of the Zika virus disease has been recorded in Africa, America, Asia, and Pacific. So, African countries, their immunity is problem, their hygiene problem, and many problems are there. Okay, the cleanliness and all. So, it's not like a developed country. It's like the third world countries, and they are still to reach the developing nation status also. So, there most of the outbreaks comes. Ebola also was there, and these are things which doesn't affect us. Okay, only when now this corona came, it is like worldwide thing, and everybody is affected, and the vaccines are all done. But here and all, it is always like the number of death. Okay, it will be very very high when such a thing comes here. Now, the pregnant women with Zika are 20 times more likely to have a baby with a birth defect. Okay, so like this, if you see, the skull size of the baby will be less, okay, or small. So, but luckily, the case which was there now in the starting of the video showed that a kid seems to be fine. Okay, so the percentage wise also we see just 2.6, 2.86 per thousand live birth. Okay, that so it's a like it's not like every baby should get this. Okay, and also it need not be always Zika. Also, there are many other genetic reasons also because of which the skull size can become like this. Okay, it's called microcephaly. Okay, and if you see the term again, Guillain-Barré syndrome. Okay, so any of this, it's all referring to the same thing only. This deformation or the skull size being lesser for the newborn baby. So this can be because the mother was infected with Zika. Okay, but as I told, this Zika need not be the only reason for this to happen. It can be due to some other genetic defects also. Certain facts about mosquito for your exam sake and all. So adult mosquito live indoors and outdoors. They can bite day and night. They live for about 2 to 4 weeks depending on the species, humidity, temperature, and other factors. Female mosquitoes often live longer than the male. Only female mosquitoes bite people and animals to get a blood meal. Female mosquitoes need a blood meal to produce eggs. Mosquitoes get infected with germs such as viruses and parasites when they bite infected people and animals. It takes just a few infected mosquitoes to start an outbreak in a community and put you and your family at risk of becoming sick. So it's this and all. Maybe biological students and all will need these terms, but else for other exams you won't need. Now, if you take the symptoms and some details, okay, about 1 in 5 people infected with Zika virus become ill. Okay, meaning Zika enter your body, it need not necessarily that you fall ill. Maybe it will just go away just like a small flu or something. But some 1 out of 5 people get infected, it becomes serious. The most common symptoms, as I told, fever, rash, joint pain, conjunctivitis, that is red eyes. Then other common symptoms include muscle pain, headache. Then the incubation period, that is the time from the exposure to the symptoms. Okay, that is for Zika virus is not known, but is likely to be a few days to a week. The illness is usually mild with symptoms lasting for several days to a week. Zika virus usually remains in the blood of an infected person for a few days, but it can be found longer in some people. Severe disease requiring hospitalization is uncommon. The disease will also be transmitted through blood transfusion or sexual activities. Avoiding chances of mosquito bite is the ideal way to prevent the disease. Even last time, when I think 2016 Rio Olympics was going on, the case was very high in Brazil and all, and so many people were even afraid to send their people to go and compete in the Olympics. Okay, so many people did not go also. So this kind of worldwide events happen, but deaths are rare. Okay, deaths are reported rare. It's the deformities which happen, and the diagnosis, if you see, the symptoms are similar to other diseases like dengue and chikungunya, which is also caused by the same mosquitoes that transmit Zika. So if you see like symptoms is there, okay, you have to get treated obviously. And if you haven't recently traveled, tell your healthcare provider when and where you traveled. Your healthcare provider may order blood tests to look for Zika or other similar viruses like dengue or chikungunya. And as I told, there is no vaccine or medication, but like plenty of fluids has to be drunk. Dehydration has to be prevented, and best way is to prevent. No vaccine exists as of now, and you have to avoid. Okay, and to avoid mosquito bites, there are a lot of things at the end of this video I'll show you. So the mosquitoes that spread Zika virus bite mostly during the daytime, I already told. And now this dengue and chikungunya comparison, and we'll end this video. Like dengue is transmitted by several species of mosquito within the genus this Aedes, and symptoms include again the same similar kind of thing like the measles disease and all. Dengue vaxia is the vaccine which is there, but Indian drug controller is yet to grant approval. Okay, but there is a vaccine for dengue at least, and India has reported these many cases as of 2019. Now chikungunya, if you see, it is caused by mosquito-borne virus. Again, Aedes aegypti and Aedes albopictus. So these are female night mosquitoes. Okay, most of them, and its symptoms and character are characterized by abrupt fever, joint pain, swelling, headache, and there is no antiviral drug treatment for this thing. Okay, so you should know which one has vaccine and which one does not have vaccine. But by the time you give exam, maybe the things will change. Okay, these are again various diseases. Malaria is there, West Nile virus is there, yellow fever is there. So there are 6 to 8 diseases which is spread and caused problems across the world. So you have to know the names also, and like which type of mosquito causes it. And as I told, to prevent mosquitoes, there will be like various guidelines. First thing is this water accumulation. You should not allow. Okay, wherever it is, you should not allow. Whether let it be outside your house or in this coolers or air conditions or refrigerator, anywhere in the tires or in small cups, whatever is there outside and around your house. If you stop this and then take this kind of repellents and net and all these things, you will stay safe. Okay, because in middle of this corona, this also you cannot afford, because again you will have to go to doctor, come back. It affects your entire family. Okay, so stay indoors, stay safe, and take care of all these things. Subscribe to all our channels so that we can keep giving you free content every day. This video also was made as per request of certain students. So I'll come up with the next video. Subscribe and support. Thank you. Have a nice day.